And as hospital and ICU rates continue to rise, nurses, unions, and other healthcare organizations continue to call for the Ontario government to repeal Bill 124, which currently limits nursing salaries. Here's Joshua Santillana to give us more.
This week in Ontario, more and more healthcare workers are demanding the repeal of Ontario's Bill 124, a wage legislation that has impacted healthcare professionals, registered nurses, and nurse practitioners negatively amidst the COVID-19 pandemic. Passed in 2019 as a Protecting a Sustainable Public Sector for Future Generations Act, Ontario Legislative Assembly claims Bill 124 ensures increases in wage compensations reflects the fiscal situation of the province and therefore will protect the sustainability of public services. However, the bill suppresses the wage increase for healthcare workers, those who are in the front lines of this pandemic. Because of Bill 124, wage increases are only a maximum of 1% total compensation, lower than the rate of inflation, for 3 years for registered nurses, nurse practitioners, and healthcare professionals. More Ontarians are demanding that the government bring their attention to the health system on the verge of collapse, especially now during the Omicron variant's peak, where hundreds of thousands are testing positive for the virus in the province. Ontario continues to see one of its biggest healthcare staffing shortage in hospitals and other healthcare facilities. It is important to note that these healthcare workers provide care not only to patients with COVID, but also to those admitted to hospitals and healthcare facilities for non-COVID related illnesses. As of January 9, the total number of active cases within the province is 137,822. As of January 10, 2,467 of these COVID patients are hospitalized and 438 are in the ICU. In Toronto, Joshua Santillana, Eagle News. We live in interesting times.